let's just start with the details from that NGO that's alleging that police or security forces in Nigeria have killed many more people than coronavirus itself has.
Yes, that is absolutely true.
And
absolutely true. And the National Justice Commission has been speaking up about the situation. So something that expected was going to happen. Maybe it's a time we don't really quite understand a lot of what's going on. But, you know, some security agents to actually follow protocols for times like this, where this important thing. Unfortunately, you're actually correct. How people dead from security forces.
But Kayla, what sort of evidence, apart from the videos, for example, that this organization gets from the public, are they putting forward?
When you say they putting forward, you mean the National Human Rights Commission or
the NGOs that says they received videos from people?
Yeah, well, the NGOs are not just working on just the videos that they got. Those videos were just there's an active investigation going on right now. Oh. And the National Human Rights Commission has actually spoken up about this. More people dead. I was, Mr. Tony Ojukwu is his name. I was speaking with him recently, and he actually confirmed. He said this has been going on. It was, first of all, human rights abuses going on. And, you know, the Human Rights Commission spoke up against that, only for us to now have the evidence of people being killed by security agents. But, you know, it's still, this is still in the investigation period. So they're still trying to find out what led to what. We saw a situation in Anambra State. We actually covered that in the news. We also saw one somewhere in the Niger Delta. So these are situations that are still being investigated, but, you know, the reports have been coming in.
Well, we'll see how the investigations go. But apart from that, is there any who is doing this investigation apart from the commission? Are the security agencies themselves? And I'm saying this because here in Ghana, when similar issues came up, the military, the army, said it was doing its own investigation as well. So are there parallel investigations ongoing, or is this just the business of the commission?
No, it's not just the commission, it's everyone. It's a joint effort. The police is also doing their own investigations, you know, because to get this sorted out has to be something everybody's a part of. No one wants anyone to die. No one condones any killings. So yes, security agencies are also carrying out their own investigation. And they say when this investigation is done, that those who are found culpable will be punished. So we're waiting to see how that works out.
Interesting. Let's look at the coronavirus cases itself. Do you have any updates to share with us, Kayla?
Oh yeah, the number keeps rising, unfortunately. 442 as at 11 hours ago. And then we have a lot of people who have been discharged, by the way. So we have 442 cases right now. Abuja, Lagos, Kano, and Osun are the places with the most number of cases of coronavirus. And then, of course, we have a lot of people who have been discharged. 152 people have been discharged so far. And then we have 13 people who have died, unfortunately, from the disease. So that is the update right now from Nigeria.
Doing any comparison, we're way ahead of you. 442, we are at 641 at the moment. We're learning that 8 people, there's a possibility of also of 1 more. So about 9 people have died here. And that's how our situation compares to you. But so far, how has the lockdown in Nigeria, for example, gone? Nigeria is a big country with so many people. Here in Ghana, we're managing. It's not been easy for the security forces. Generally, how are people reacting and taking in this lockdown? What kind of conversations are going on?
It hasn't been easy. I do have to tell you that. I know that in Ghana, you know, you're probably not having to deal with the kind of population that we're dealing with here in Nigeria, but it is very difficult for lots of people to obey the sit-at-home order. Remember, we also have a lot of people who are poor, who depend on their daily activities to feed. So a lot of them still feel the need to go out and do one thing or the other. Now, but there are a lot of things going on, all right? So while people are having a difficulty with the testing, with the lockdown, there's something called community testing, which has started. So what's happened is the Nigerian Center for Disease Control has started doing testing for coronavirus in communities. And, you know, like in the nation's capital, for instance, the suburbs, one of the places, the suburbs of the nation's capital have a lot of it, very densely populated, you know, and some of the cases of coronavirus that they're dealing with right now didn't have any links with people who had traveled out of the country. Most of it were just people who are in communities. So they start, because if these densely populated communities become infected, then we might have a situation that we cannot handle. You know, so community testing has started. The lockdown has gone tighter. In the nation's capital, for instance, you can only go to the market twice a week now, between 10 a.m. and 2 p.m. You know, and then anytime after that, they turn people around and, you know, try to get people to stay at home. The reason, and I try to reiterate this as much as possible, the reason for the lockdown is so that people who have this disease will start to show symptoms and will have no choice but to go to the hospital. You know, so that is what it's about. And I think many people are coming to terms with that. It's a little difficult for people, especially Nigerians who are used to doing what they want to do whenever they want to do it. It's a little difficult for a lot of people. People are calling out for palliatives. The state governments are trying to handle that. State governments are coming up with one thing or the other to help people who are staying at home at this time. In the nation's capital, we're seeing that palliatives are being distributed in many communities. Some people who have been part of the National Social Register, which is the register of the poorest of the poor in Nigeria, they've actually decided to give them 4 months. They give them 5,000 naira every month. They decided to give them 20,000 naira at a go. You know, that way they can take care of themselves.
Looks like I lost Kayla there, but very interesting information. He says that Nigeria actually has a register of the poor where they have people listed as the poorest of the poor, and they get 5,000 naira. Those people are getting 20,000 naira because of the situation. We do have let's wrap up that conversation with her. Kayla, I was very much interested in the register of the poor.
Oh yeah, the National Social Register. It's a very big deal. It was done in 2015. It was done alongside the IMF. So it was the IMF that helped us come up with that register as a country. And basically, what they did was look for people who are in the worst situations in the country. They started giving them incentives for their business. We're talking maybe people who sell akara on the street, bean cakes on the streets, people who, you know, depend on their daily activities to survive. So a lot of those people have been a part of this National Social Register for years. And like I said earlier, they have been giving them 5,000 naira every single month so they can help grow their businesses, they can take care of themselves. Now with the coronavirus ravaging the country, they cannot go outside right now to carry out their businesses as they normally would. So what they've done is take that National Social Register, give them 4 months of the money together. So instead of 5,000 naira, they got 20,000 naira. Now here's what's happened. After that, a lot of people in the country were figured, you know, I want to be a part of this. I don't have any money. I'm not able to take care of myself. So what President Muhammadu Buhari has done since that complaint is that he decided to expand the National Social Register by 1 million people. So they're going to be adding people who are not necessarily the poorest of the poor, but who are not well off, who are not able to take care of themselves at this time. So they're expanding that register by 1 million people. And then, of course, they'll be giving them palliatives. And it will continue. You know, there's an ongoing process. We're just seeing the beginnings of this. We don't know where it's going to end. But what is being done right now is all I can tell you. Expanding that National Social Register by 1 million people and making sure that they get the palliatives that they need for this particular point in time. And that is in addition to the fact that state governments are doing what they can to take care of people, you know, who are suffering at this time. So that's where we are on that.
We're doing so too in Ghana, but it's come up with, it's had its own issues, including politicization or accusations and allegations of politicization. I don't know if there's anything going on like that, but perhaps next time when we come to you, Kayla, we'll be able to tease out all of those details. Thank you so much for this afternoon.
Thank you so much.
We've been speaking to Kayla. Kayla Megwa is an editor with Channels TV, our partners in Nigeria. We go back to Kenya, where now the Chinese government is currently investigating allegations of inhumane treatment being meted out to African nationals, including Ghanaians. That's according to Chinese ambassador to Ghana, Shi Ting Wang. there's been global concerns over forceful evictions allegedly targeted at Africans in China over the past few days. Ambassador Wang said these were very serious allegations and not a matter his home government takes lightly. He was speaking at a short donation ceremony at the Chief Imam's residence today.
Believed that you also, everybody concerned about some African citizens in Guangdong province. The Chinese government attaches great importance to this situation, and